Breaking news this Tuesday night, Canada's sweeping new travel restrictions. The measures arriving at airports as the Omicron variant spreads.
Travel rules and border rules in particular can always change.
Rejecting the mandate to vaccinate.
It is disappointing.
The thousands of provincial employees shooting down the shot. BC can't catch a break as another atmospheric river rolls in.
It's like, is this going to keep happening?
The province's record-breaking rainfall.
Global National with Donna Friesen.
Good evening and thanks for joining us. As the holiday season approaches and people plan to travel abroad, there are new hurdles to overcome. Canada is introducing new rules for travelers because of the potential threat from the new variant Omicron. Anyone entering the country by air, even those who are fully vaccinated, will now need to do a PCR test on arrival and self-isolate until they get a negative result. The only exception is people flying from the United States. The time frame for this is not clear. The public safety minister admits it will take time for airports to organize, and it may be expanded to land borders.
We are also working quickly with provinces and territories to determine how we could expand testing capacity to include all travelers from all countries, including the United States, from both land and air, if needed in the future.
As well, 3 new countries have been added to the list of nations from which travelers are banned: Nigeria, Malawi, and Egypt. Canadians or those with the right of entry to Canada who have been in those countries must quarantine and be tested on day 1 and day 8. The new measures are part of Canada's rapidly evolving strategy to contain the spread of the Omicron variant. Its emergence last week has prompted the return of border closures, travel restrictions, and stricter testing requirements in many countries. There are confirmed cases in many countries now, including at least 7 here in Canada, in BC, Alberta, Ontario, and Quebec. Yet there remain more questions than answers about this new variant and how much of a threat it really is. Eric Sorensen looks at what we know and don't know.
In Canada, only a few Omicron cases have been detected, but it's enough that Ottawa is asking the National Advisory Committee on Immunization for updated guidance on booster shots.
Whether we should revise national standards, national attitudes and actions on the use of boosters across Canada in the context of the new Omicron variant.
It has some Canadians thinking twice about their holiday plans.
I literally just talked to my in-laws last night and we said, you know what, let's revisit this in a week.
If there is a surge in COVID cases, it will be met by something that didn't exist a year ago: a wall of vaccinations around most of the community. It's not an impenetrable wall, but it's still a wall.
The head of Moderna, one of the biggest vaccine producers, says Omicron's many mutations may render vaccines less effective.
Given the large number of mutations, it is highly possible that the efficacy of the vaccine, all of them, is going down.
But Pfizer is still bullish on the current regimen.
This drug works for all known mutations, including the Omicron one.
Infectious disease experts agree the current vaccines are working.
We're not seeing the catastrophic situations now where the hospital beds are about to exceed capacity. So, and I think a lot of that is because of the vaccination.
It could take a few weeks before scientists determine whether new vaccine boosters are needed or would help.
The aim, the task at hand is to delay the dominance of the variant in Canada as long as we can. We just need to get ready and face the music. Once Omicron becomes dominant, we probably need to intensify our response a bit.
That could mean wearing masks more often or reducing capacity again in crowded places. Still, Canadians are better protected this winter, and Jeanette Purser will take advantage of that.
We didn't see our daughter and her family last year. It broke my heart, so we're really excited about it this year. Everybody in our family who can be vaccinated has been vaccinated.
And getting vaccinated, say scientists, remains by far the best protection. Eric Sorensen, Global News, Toronto.
The true extent of the spread of the Omicron variant is unclear. What is clear is that cases are turning up almost everywhere now. 13 were reported in England today, and the UK is launching a new campaign for booster shots. As Crystal Goomansingh reports, the head of the WHO says the emergence of this variant exposes the need for global vaccine equality.
With a new variant of concern spreading, vaccination centres will once again be the UK's front line of defence.
The target that we've set ourselves is to offer a booster to everyone eligible by the end of January.
The UK was the first Western nation to start vaccinating its citizens against the pandemic virus. Nearly a year later, every adult in the UK is being encouraged to get a third COVID-19 shot. Given the mammoth scope of the initiative, the military is being asked to help out once again.
What we're doing is taking some proportionate precautionary measures while our scientists crack the Omicron code.
While there are many unknowns when it comes to this new strain, the head of the World Health Organization says cracking the code of this pandemic is not a mystery. It's about equitable access to vaccines. Countries in the south of Africa have reported the majority of cases with the new strain. Not surprising, given the continent as a whole has a vaccination rate of around just 7%.
The virus is a ruthless opportunist, and the inequity that has characterized the global response has now come home to roost.
New restrictions have been implemented around the world after Omicron was identified on November 24th by South African researchers. But no one really knows for sure when the mutation started circulating. The Netherlands traced a case going back to November 19th, and Scotland traced a case back to the 20th.
I think a lot of people are worried, particularly in the run-up to Christmas, and worried about the implications. And obviously everyone wants to be able to travel, meet family and things like that.
Boris Johnson says vaccine clinics will start popping up like Christmas trees around the UK. And for now, there's no plans for a lockdown. Crystal Goomansingh, Global News, London.
Two other important notes about travel. Canadians taking a trip to the U.S. that's less than 72 hours long no longer need a negative PCR test to re-enter the country. The relaxed rules apply to fully vaccinated Canadian citizens, permanent residents, people registered under the Indian Act, children under 12, and those with a medical exemption to the vaccine. Travelers will still need to show proof of vaccination and proper ID. And starting today, unvaccinated Canadians over the age of 12 won't be able to board a plane or passenger train in Canada. The grace period for the policy, which took effect October 30th, has now expired. A negative COVID-19 test will also no longer serve as a substitute for vaccination. Now to British Columbia, where heavy rain is falling again tonight. For the third time in a week, an atmospheric river is drenching southwestern BC, where flooding and landslides have already disrupted the lives of thousands of people. It has been the wettest fall ever recorded in the Pacific Northwest. Rainfall records were broken in many places, including Vancouver and Abbotsford. And it's not over. The red on this map shows rainfall warnings in effect on BC's south and central coast.
This storm may not have the same level of intensity as we saw mid-month in some of our hardest hit areas, such as the Fraser Valley, but the cumulative effect of this succession of storms will be and continues to be a major challenge.
In Abbotsford and the Fraser Valley, farmers already flooded once in the Sumas Prairie area are watching the water rise again. That's where our Heather Yourex-West is tonight. Heather?
Donna, it has been a very busy day for already exhausted city crews and residents, with localized flooding today along the Trans-Canada Highway through Abbotsford, as well as onto farmlands of both the Sumas and Matsqui prairies. A number of buildings and homes have had to be evacuated today as this community deals with heavy rain once again.
The tractor and some muddy oars. When the Sumas Prairie was flooded nearly 2 weeks ago, it was the only way Ed Friesen could get around his farm.
The flow of water it was so strong you couldn't stand up, it would take you away.
But instead of cleaning up, the poultry and blueberry farmer is bracing for yet another storm.
Well, we sandbagged the barns, the back doors. We got all the equipment on the high ground this time. And yeah.
This is water from the Nooksack River that is now making its way into the Sumas Prairie, adding to the burden of waterlogged farmers who are desperate for things to start drying out so they can clean up.
And this water is largely from last weekend's storm. There is still more rain to come, with another atmospheric river now bearing down on the region.
This event is very strong. It's the third consecutive storm in a week with very little respite in between these events. So the effects are cumulative. Snow melt is also a component of this event and will add to the storm totals of rain into the rivers and creeks.
I am optimistically hopeful that we're going to get through this round 3.
Abbotsford's mayor says so far local infrastructure, including a newly repaired dike along the Sumas River, is standing up against the pressure. Hundreds of members of Canada's armed forces have also helped the city prepare.
So the water was up to the sandbags, roughly a foot below the top layer, which is why we built a foot up, and it's doing the job it's supposed to.
But for the flood-weary, the seemingly endless rains are taking a toll.
It's heartbreaking. It's like, is this going to keep happening? The poor farmers down from us too, the cows. How much can people take?
After a summer of drought, the region now experiencing the wettest November it's ever seen.
And these rains will continue overnight into Wednesday before there is finally a break in the forecast. Officials hoping then focus can turn to recovery. Donna?
All right, thanks, Heather. The atmospheric river is also heightening the risk of avalanches. The avalanche danger is now high to extreme in mountainous regions across much of BC. Back-to-back weather systems have left a huge accumulation of snow at high elevations. Makes for great skiing, but rising temperatures and extreme winds can also create perfect avalanche conditions. The community of Hope was completely cut off by the catastrophic rain and flooding over 2 weeks ago. And now major highways are closed again as a precaution, isolating Hope for a second time. Robin Gill reports.
Brian McLean is counting on 500 sandbags in case the river behind his home gets the best of him.
I'm 72 years old and, that's my retirement package.
The Riverview neighborhood in Hope, BC sits on the banks of the Coquihalla River.
It's pretty hard to determine. The river's as high as it usually gets, so, the 100 milliliters could really cause some problems.
Don't they know it?
I don't want to see that water up against my front door. It got too close the first time.
Neil Peterson barely sleeps after floodwaters rushed up to his house 2 weeks ago.
I get up at every 2 hours or so and I go walk down the river and see how high it is, see if it's going up or down.
Just to give you an idea of the extent of the storm damage here in Hope, this is a fellow road, and it's not lost on the people who live here that that's a reference to a Shakespearean tragedy. This may seem like it's the end of the road, but in fact, this road extended way beyond those construction crews. There was all this land in between, but the river now runs through it.
Hope is used to being a stop for people traveling between the Lower Mainland and the interior of British Columbia. But the Trans-Canada Highway is closed, and Hope is a ghost town. That's worrying the mayor.
Businesses have really taken a hit, of course. The highways are open, the highways are closed.
Highway 1 is the single most important artery in the Lower Mainland. And when it's closed for an extended period, I know that it's difficult and very challenging for people.
But the main worry is protecting homes. A dozen are on evacuation alert. Brian McLean and his friends managed to clean up the mess from the last time.
I've already had my house flooded once.
And for him, that's enough. Robin Gill, Global News, Hope, BC.
Coming up, the pandemic's tragic impact on people who didn't have COVID-19. We know the pandemic has strained Canada's healthcare system, and a new report from the Canadian Medical Association puts it into perspective. Thousands of Canadians died from COVID-19, but the report found thousands of others died from delays getting treatment. Abigail Beeman explains.
I'm at the bitter end here. I've been hanging by a thread for a while.
Fighting kidney failure since 2018, pandemic backlogs mean Jessica Bailey is still waiting for a transplant, in a lot of pain with less than 1% kidney function.
It scares me, to be honest, in my position. As a palliative patient, they say they give you about a year. And if we're backlogged more than a year, then, my odds aren't very good.
Scared by the findings of a new report with a sobering headline, more than 4,000 excess deaths due to delayed care unrelated to COVID. And that only covers the period between August and December 2020.
I don't know what else we need to do to make it more clear that we can't just focus on the pandemic.
Laura Harilak is an ICU doctor who has seen her share of COVID, but also too many chronic illness cases left untreated, she calls heartbreaking.
Didn't or couldn't access care, or too afraid to access care, who come in with a very acute complication of that illness that could have been prevented, but ultimately an acute complication that took their life.
In Ontario, in-person visits plunged for diseases including congestive heart failure and diabetes at the start of the pandemic, nowhere near normal levels by January.
Really getting a sense of how bad the health system was impacted really actually was quite shocking.
The report warns correcting the problem will take years and cost at least $1.3 billion to return wait times to pre-pandemic levels by next June. That's just for 8 surgeries, including cataracts and hip replacements, with more than 300,000 people waiting. The health minister pointed to campaign promises committing to address the issue and said the total number of delayed surgeries is actually much higher.
There would be approximately 780,000 delayed surgeries in Canada at this particular time.
The actual impact is much broader than that. So the $1.3 billion to get us back on track, I think, is really just a starting point of what is needed for the system.
Saskatchewan just resumed organ transplants, yet is still impacted by staffing shortages.
Becoming part of that statistic is scary.
The delay means Jessica Bailey's live donor is no longer a match. She's now looking for another with O-positive blood. Abigail Beeman, Global News, Ottawa.
Vaccinating public servants in Canada ahead. How many are still refusing the shot?
You're watching Global National.
COVID-19 vaccine mandates are now in place across this country. In Nova Scotia, this is the last day for some employees to prove their vaccination status. Newly released information from 3 provinces shows the majority of provincial employees are following the terms of government vaccine mandates, but thousands of others are not. As Ross Lord explains, that's despite extensions to deadlines and a softening of hardline positions.
Their union says all of these frontline healthcare workers are fully vaccinated as they rally for better wages and working conditions. But for some others, it's deadline day to either get their shots or be sent home without pay.
I'm sure there are some people that are going to be going off as of today on administrative leave.
The Nova Scotia government isn't saying how many provincial employees are refusing COVID-19 vaccines and are off the job. It does say there might be some disruption to school busing. Nova Scotia says 99% of provincial employees have at least 1 dose of the vaccine. Elsewhere, British Columbia says 98% of its workers are partially or fully vaccinated, although 432 employees are not or have not revealed their status. Alberta says 96% of healthcare workers are fully immunized, but that leaves a sizable number of holdouts.
It is disappointing that about 3,000 of our staff have either not submitted proof of vaccination or have decided to remain unvaccinated.
And Alberta is backing off from some employees, introducing rapid testing at locations where forcing unvaccinated employees off the job would undermine healthcare services.
I do not want to see services in any community reduced because staff are unable to work.
Quebec and Ontario have already softened their hardline positions with a prolonged stare-down between health authorities and holdouts, some of whom threaten to launch legal challenges under the Canadian Charter of Rights and Freedoms.
The real question is, will it likely succeed? And there, I think at the end of the day, the answer is no.
Resistance won't stop there. The country's largest healthcare union is open to filing grievances on behalf of some unvaccinated members.
We don't assume that the position of government or employer is always the right position.
More decisions to come about vaccine policies as the pandemic drags on. Ross Lord, Global News, Halifax.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is Quebec City, getting festive for the season. We'd love to see your Canada, especially merry and joyful pictures from the places you love. Send them to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.